My name is Tim Isenhower. I'm the Director of Benefits for HSM in Hickory, North Carolina. I've worked with the health insurance for 23 years with HSM, so I've seen a lot with HSM as far as our health plan has evolved to what it is today. In the beginning when we offered the program, primarily the folks going to India and Costa Rica were our hourly paid employees that a lot of them couldn't afford the out-of-pocket expenses here in the U.S. for surgery, so they started choosing that option to not have the out-of-pocket expenses. As the program grew and people explained their successes as they came back from these countries, the range of people that go now range from executives down to our hourly population. So just about everybody within our sectors have gone. I've been very surprised that the return to work, the time that it takes a person to return to work after having surgery in Costa Rica. Physical therapy they receive down there is just phenomenal. To when they come back here to the U.S., they're a little step above the folks in healing than they would have been had they been here in the U.S. So they return to work much quicker than we expected. In the beginning, some of the surgeons were a little upset that they were losing that business, and they would tell patients, you know, if you have surgery down there, you're going to have problems, and there's just a lot of falsehoods going around that were quickly dispelled the more patients that went to Costa Rica for surgery and came back in such a higher level of healing than what they had here in the U.S. We send a wide variety of procedures to these countries for surgery. They range from outpatient procedures if they're going to Costa Rica, all the way to back surgeries that require a lot of rehab and extended stays in Costa Rica, maybe sometimes as long as 17 days. The procedures are performed down there. The patients have done very, very well. We've had very few complications. They return home in just a much better state than what we see here locally. We've tried to calculate savings for the program. We've been doing this for about 9 years now. We're estimating roughly at this point maybe $13 million in savings. HSM's gotten quite a bit of publicity for this program that we've offered just because we were one of the few in the country who've offered it. We've been able to keep our out-of-pocket expenses for our employees lower than most people because of this program. So our benefits can be richer than most that applicants or people looking for jobs see. So it's been a great recruiting tool for HSM. We have several health plans within HSM. Some are high deductible plans, so $3,000 out-of-pocket maximum. Once you've paid that out-of-pocket, you're covered at 100% here in the U.S. A patient going to Costa Rica for surgery would pay nothing. We actually pay at their expenses at 100%. We pay for a companion to travel with them. We pay for the hotel, lodging, procedures, food, passport, everything in total. And when they return home to the U.S., we give them a bonus of up to $10,000 based on 20% of what they saved the company. IndUShealth has been a great partner to HSM in our global healthcare program. We could not have done it without them. They've got a great staff of nurses and physicians that oversee patients that go to these countries for various procedures. They're very well screened before they go. IndUShealth has been wonderful to contact these employees that are interested in the procedures. They make them feel at ease about going abroad for surgery. People are actually looking forward to it after they've worked with the nurses at IndUShealth. They're very upbeat, very informative, and we couldn't have done it without them. IndUShealth does a great job managing the expectations of our employees when they're entertaining going abroad for surgery. A lot of our employees have never even been on an airplane before, and they're made to feel comfortable traveling by air. The folks at IndUS are very well experienced, and they know how to talk to our people, and they can relate one-on-one with our employees and put them at ease to where there's not a lot of anxiety for these employees going for other countries for surgery. Companies looking at options for medical tourism really need a good partner to coordinate this for them. You know, I'm a busy guy working with benefits. I work with 401k plans. I work with pension plans as well as our health plan and workers' comp. I don't have time to coordinate travel, a lot of the comforts that these patients need when they travel abroad. And IndUShealth is a pro at that. I mean, they've done it long enough to where they have the procedure down pat. Once one of our patients connects with IndUShealth, I don't have to worry about them anymore. IndUShealth takes care of those patients. Companies that don't look at this option are really missing the boat, because you look at our employees, they're very, very happy with this program. They love our health insurance program. I get letters of thanks about our health insurance programs, which never happens. I mean, how many benefit directors out there have received a thank you note for the hospital stay at a local hospital? So they're doing a disservice to their employees by not investigating this, as well as themselves. I mean, the cost reductions are phenomenal. The results are phenomenal. They're missing the boat if they're not looking at it.